Why does it happen at night? Anxiety is a normal human emotion, characterized by feelings of panic and anxiety. You may find yourself experiencing anxiety during stressful situations, such as a first date or a job interview. Sometimes, anxiety can last longer than usual. If this happens, it can affect your daily life, and at night. Many clinical trials have found that sleep deprivation can be a source of anxiety. Historically, research suggests that anxiety disorders are associated with reduced sleep quality. Treating your anxiety at night and dealing with your sleep problems are important steps in improving the quality of your health. What is anxiety? And what are anxiety disorders? Anxiety is a feeling of discomfort. It is not uncommon to experience occasional anxiety in response to frightening or stressful situations. Many people with anxiety disorders try to avoid situations that can cause great anxiety. However, this does not solve their basic fears and may interfere with professional and personal activities. Over time, a person with bipolar disorder may become so accustomed to anxiety that it becomes a state of depression or fear. Anxious people may feel overwhelmed and in danger. This can affect their concentration and emotions, which has led to irritability and instability. Their fears or feelings of impending doom can feel overwhelming and uncontrollable. Physically, anxiety disorders can cause muscle spasms, rapid breathing and heart rate, sweating, tremors, intestinal depression, and fatigue. What kinds of anxiety disorders? Anxiety is a major component of certain problems, although not all of them are strictly classified as anxiety disorders. Number 1. Generalized anxiety disorder, GAD. People with GAD have significant problems, which come in many forms and can cause great anxiety. Number 2. Panic disorder. Severe panic episodes, known as panic attacks, which usually last a few minutes at a time, are a descriptive feature of panic disorder. Number 3. Social anxiety disorders. These disorders include excessive fear of social settings, and embarrassment that may occur in front of other people. Number 4. Some phobias. Some phobias are a great fear caused by certain causes. Some very special phobias include agoraphobia, which is fear of open or closed spaces or being in a crowd, or just being out of the home. Number 5. Post-traumatic stress disorder, PTSD. This condition can occur after a person has been exposed to a traumatic or disturbing condition. People with PTSD may remember a stressful event, feel marginalized, and have anxiety that can weaken them. There are many signs and symptoms of anxiety. Everyone experiences anxiety differently. Symptoms can occur at any time of the day, morning, or night. Common symptoms of anxiety include feelings of shock, restlessness, or anxiety. You have trouble concentrating. You have trouble sleeping, or staying asleep. Intestinal problems. Another symptom of anxiety disorder is panic attacks. Panic attacks are an episode of extreme and intense fear, which is often accompanied by physical manifestations. Common symptoms of panic attacks include a sense of impending doom, increased heart rate and chest pain, shortness of breath and sore throat, sweating, cold and hot flashes, dizziness or lightheadedness, a feeling of isolation, or a real dislike for nothing. In some cases, you may wake up and experience panic at night. According to the Anxiety and Depression Association of America, ADAA, more than 50% of people say their anxiety levels affect their ability to sleep at night. There is very little scientific research on night anxiety. However, there are many reasons why your anxiety can get worse at night. You may feel that your mind is racing, and you can't stop your thoughts. You could focus on the day's troubles or expect things in your to-do list for the next day. This apparent stress can cause the body to experience an adrenaline rush, making it extremely difficult to sleep. How often are anxiety disorders? Anxiety disorders are the most common form of mental illness, affecting the lives of about 20% of American adults and 25% of young people each year. Let's talk about treatment. It is important to remember that it can take time to find the right treatment for your anxiety. Because of this, you and your doctor may choose to use a variety of different treatments. There are certain medical conditions that can cause symptoms of anxiety. Include heart disease, hyperthyroidism, diabetes, chronic pain, irritable bowel syndrome, certain brain tumors. If any of these conditions are a concern for you at night, your doctor will want to treat them first. Let's talk about psychotherapy. There are many types of psychotherapy that can treat anxiety. One of the most well-established approaches is behavioral psychotherapy, CBT. CBT is a form of psychotherapy that encourages changing your ways of thinking to improve your behavior and mood. Let's talk about medications. In most cases, treating anxiety requires a two-pronged approach. Both psychotherapy and medication can be used jointly to produce excellent results. The most common drugs given for major anxiety attacks are benzodiazepines. The most common drugs prescribed for long-term anxiety disorders are antidepressants. Here are some tips for living that can help you relax and reduce your nightmares. Number 1. Deep breathing. Deep breathing is a good way to reduce anxiety and depression. Deep breathing can reduce your heart rate and improve your blood pressure. If you experience panic attacks at night, try deep breathing to reduce the seizures. Number 2. Healthy sleep habits. One of the most important ways to reduce nighttime stress is to use healthy sleep habits. Ensuring you are happy and comfortable in your bedroom will help improve your bedroom quality. Number 3. Exercise daily. Exercise can help improve sleep quality and duration.